The first point to keep in mind is that the European response to the COVID pandemic has not been uniform. We've seen significant differences in terms of the abilities of countries to quickly enforce lockdown measures, the abilities of states to also rapidly test. Certainly, I think it's fair to say that the European states and the EU fumbled its response in the early stages. I think there are a couple of factors that explain this. Firstly, there's the memory or the erroneous lessons of previous outbreaks such as SARS, MERS, or Ebola. In those cases, these outbreaks were far more confined to the regions of origin and did not really reach Europe in the same way that we're seeing today. So I think there was a tendency or a temptation to believe that COVID was a Chinese problem as opposed to something that had high potential to get to Europe. Secondly, I think there was also distractions with other political problems. In late February, early March, there was a renewed fear of a new bout of migratory flow from Turkey to Greece. And that really captured the attention of the European Commission, of the executive of the EU. Again, you've got to keep in mind that immigration is a topic that has real salience among the European public. And I think there was a pressure on the Commission to be seen to acting decisively on that topic. So I think it took a while, it took too long in a sense for the European nations to realize the gravity of the situation. The key moment in my estimation was when Italy started to face significant problems. The healthcare seemed to face the risk of being overwhelmed. And that was, I think, a wake-up call for many European nations. Now, I think you have to add the caveat that we're still in the early stages of the fight against the pandemic, and that countries that seem to be faring well now may not be the same several months from now. How countries are going to manage the moving away, the easing of restrictions, the moving away from the lockdown is also going to be crucial and going to be difficult. But in the early phase, I would say a couple of countries stand out. I think certainly Germany has done a very good job in keeping the death rate relatively low. So how did Germany do it, or what was specific about Germany? I think there are a couple of factors, some that were based on Germany's pre-existing assets, as well as some bouts of luck. We need to be careful when we're making these early comparisons because not all states face exactly the same situations. For instance, there was certainly reports made on the fact that although Ireland and the United Kingdom started with a similar ratio of beds per 100,000 people at the start of the pandemic, Ireland has been able to keep its death rate significantly lower than that of the UK. So that seems to suggest that it's essentially measures taken by the Irish government that have been more effective than the UK's government in terms of controlling the outbreak. There's certainly some truth to that. I think, and I will allude to that, the UK was slow in the early stages of the crisis, and that certainly has had repercussions. But there are also fundamental differences between those countries that may play a role in exacerbating or mitigating the effect of the pandemic. For instance, the UK has a greater percentage of its population living in urban areas than Ireland. And again, you can imagine that greater density does increase the risks of infections. So that's a key factor here. Secondly, and I think this is also important, the UK has airports that are far greater hubs of international travel. So you can speculate that, in the early stages of the pandemic, that the UK might have been exposed to a greater number of travelers either from Europe or from China or other areas in the world that had been affected, and therefore increase its exposure to the virus at an early stage. far more maybe than Ireland. So I think when we're doing this comparison between countries, it just bears reminding that we have to be careful that we're not always comparing apples to apples.